So if you had a prostate biopsy or a loved one of yours had a prostate biopsy and you're wondering what the next steps are, then this video may be for you. Hi, my name is Dr. Charles Chabert. I'm a urologist and director of the Prostate Clinic, which is located here on the Gold Coast in Queensland, Australia. In the following video, I want to highlight for you what happens after someone has a biopsy of their prostate in the hours, the days, and the weeks after that procedure so that you may be better equipped to go through this process. For those of you that are new to the channel, please hit the like button if you get value from the video and consider subscribing to our channel. Okay, let's get into it. As a bit of background, the reason why we do a prostate biopsy, in essence, is to determine the potential for someone having prostate cancer. Now, you may be aware that there's been a huge evolution in how we go about diagnosing someone with prostate cancer. But in essence, if there are abnormalities of the PSA test, the prostate examination, and someone has a positive MRI scan or PET scan, we then proceed on with a biopsy to determine if the area of concern we can see on a scan is cancerous, and if it is, the characteristics of that. Okay, now there may be some geographical variation in terms of what you can expect, and the reason for that is how a biopsy is done. So for the majority of people here in Australia, a biopsy is done under a general anesthetic. It's done in hospital. So in essence, the man is asleep when he has the process. As a result of that, the man cannot drive after the biopsy, and someone would need to pick him up afterwards. For the majority of people, it is day surgery only, and men are in the hospital usually for about 2 to 3 hours. They have a pee after the biopsy, a cup of tea, and then they may head home. They may drive from the next day. In the States, in particular, that may be different, and I'm certainly aware that the majority of biopsies in America are done under local anesthetic in a urologist's office. So the man is actually awake. There may be some local anesthetic that is used during the process of the biopsy, and as a result of that, if there are no painkillers or sedative medication that are used, that man has the option of driving home on his own afterwards. Okay, so just be aware that there is geographical variation at play. Now, the majority of men are able to return to normal activity from the next day, as indicated, and the downtime is really pretty minimal. The most common side effects that many men can experience following a biopsy relate to the potential for blood in urine, blood in ejaculate fluid, and blood in the stool. And the blood in the various areas tends to be relatively short-lived. It lasts for a handful of days, with the exception of blood in a man's ejaculate fluid that can actually persist for a few weeks. I describe it to men that initially it's bright red and can be quite alarming for many men, but doesn't harm anyone. It's just to be aware that the ejaculate fluid is red. It then washes out a little bit like a bruise over the ensuing weeks and can take on a greeny, yellowy, brown discoloration until finally things settle down. What we don't want men to experience following a biopsy is a temperature or a fever. And historically, certainly in Australia, when biopsies were done in a transrectal fashion, or placing the needle through the bowel, there was, in my opinion, an unacceptable risk of developing an infection afterwards. Now, the reported incidence of an infection is around 1%, but if you, in real life situations, in my opinion, it was closer to 5 or 6%. Now, if this is purely a diagnostic test and someone gets very sick from a diagnostic test, then it's questionable what benefit we have done for that man. So I certainly, in my practice, have not been doing the biopsies through the bowel, and we have been doing transperineal biopsies since 2010. Transperineal means that the needle goes through the skin. In essence, since we have been doing that, there has been no single case of a fever. That being said, depending on where you are around the world, you may have a biopsy by placing the needle through the bowel. And please, if you do have a temperature, if you do feel unwell, these things are not normal after a biopsy, and really you need to contact either your local doctor or your local urologist to get guidance and help ASAP. So please be mindful of that. Now, depending on where the particular target lesion is within the prostate, and also depending on the size and the shape of someone's prostate, when we put a needle into the prostate to try and get a tissue sample, we run the risk of causing some swelling of that area. Now, if that area is close to the urethra or the outlet pipe of the bladder, it's not uncommon in that context for men to experience some change in their urinary symptoms. So when there's swelling of the prostate, your flow or the pressure with which you pee can come down, and men may notice that they go more frequently than they were previously. Worst case scenario, and we do see this more commonly in men who have very big prostates, is that the swelling can be so severe that men actually don't pee after the procedure. Again, this is rare, but it's just something to be aware of following a prostate biopsy. Okay, at the prostate clinic, the results are usually available within 2 working days. We do the biopsies on a Tuesday afternoon. I usually call men by the Thursday. Again, there will be geographical variation depending on the service that is available locally for you. When we get the results back, the results really say to us, number 1, is there prostate cancer, yes or no? If there is prostate cancer, then the next important characteristic that we get is something called the Gleason score. And the Gleason score is a grading system. And it basically tells us on a scale of not aggressive to very aggressive where your particular cancer sits. If you'd like to know more information about the Gleason score, please have a look at our previous video looking at that in some more detail. Everyone who has a positive biopsy then needs to be staged. And staging is the process that, or the term that we use to describe the process whereby we do a test called a PSMA PET scan to make sure that there is no spread of that man's prostate cancer elsewhere. You may be aware that prostate cancer can spread in 3 different ways: through the shell, to lymph nodes in the pelvis, or further afield to bones elsewhere in the body. And the PET scan is there to make sure that there is no spread before we sit down and have a discussion about whether or not someone requires treatment, and if they do, what their treatment options are. So following a positive biopsy, everyone has, in my practice, everyone has a PSMA PET scan. We usually turn that around within a week or 2, and then we would have a discussion where I can explain everything in a lot more detail face-to-face and then come up with a management strategy for you. The alternative to finding cancer on a biopsy is hopefully that the biopsy comes back and it's all clear. And if that is the case, then the next step moving forward really is surveillance of the situation, whereby that man will have a PSA test in around 12 months' time and a consult where we discuss where we go to at that point. Occasionally on a biopsy, we can find that there can be some abnormal cells. There are different technical terms for this. One is high-grade prostatic intraepithelial neoplasia, high-grade PIN. The other thing that we can see is atypical small acinar proliferations, or ASAP. So these are the small umbrella terms, if you like, where we can see some abnormal cells in the biopsy. If we do see that, depending on your particular nuance, your local urologist will have a discussion with you about an appropriate pathway to follow. Please, if you get benefit from these videos, I want to let you know that you have the opportunity of becoming a member of our channel, and that will give you access, exclusive access to our live events that we hold monthly, the last Thursday of every month, 7:30 p.m. Australian Eastern Standard Time. So if you're interested, have a question, you'd like to be involved in our live video format, please follow the link down below, become a member, submit your question, and I look forward to answering it for you at the end of the month. One of the most important things through this process is an appreciation that you do not need to knee-jerk and come up with an immediate management strategy. You've got time. And the most important thing is for you to understand this process. Understand your Gleason score and what that means, your PSA characteristics, your MRI and your PET scan findings. The better you understand this process, the more well equipped you are to make a decision with regards how you want to manage your disease in your life at your stage. Not everyone is the same. You will hear great stories and horror stories from every treatment that is out there. And it's important to be aware that there is a particular nuance with managing everyone's situation that is unique. So please don't feel that you need to be rushed into a particular treatment. You've got time, understand the process completely. If you got benefit from the video, please give it a thumbs up, subscribe. If you want to know more about your prostate, please have a look at this video or alternatively this video here. Until the next time, take care of your prostate.